Here. All right, I think we got it here now. So I think we're ready to get this started, get this rocking and rolling. All right, good afternoon, listeners. You're locked into WVOE 1590 AM, the voice of Ebony, where your heartbeat. I'm your host, Dr. Christopher Brown, president and founder of PressureMD Academy, welcoming you to another enriching session of Health Facts, the show where wisdom meets wellness and knowledge is always in season. Okay, we're here for another great show. We're here to, as always, to learn a little bit more about our body, about our health, and to learn, and just make ourselves a little wiser, a little healthier. We're always doing those two things at the same time. So let's go ahead and get ready to get started. Of course, this is, kind of kidney awareness month. We kind of mentioned that before. And, we did all the, kind of went over the kidneys in general. It's kind of interesting. This weekend, I was given a presentation, and this is what kind of sparked me wanting to do this show. And as I kind of went over what the kidneys do, how they function, how to monitor the kidneys, one of the people that was in the audience, asked this question, like, Dr. Brown, you mentioned all, diabetes, hypertension, but what about lupus? And, the individual had, I guess, she had, lost a kidney, actually lost two kidneys. She's been on and was on a third, but had family members that also had complications secondary to lupus. And I had to admit, like, yeah, that lupus is a cause for kidney disease. Now, one of the things about lupus is, it's an interesting disease, because what it is, lupus is a disease where the body fights itself, but it can present in so many different ways, and it can be very, very mild. Sometimes people get a flare of lupus and then never see it again. Other people will get lupus, and you can die from lupus. From complications of lupus. Lupus can really be in a very quick period of time. So it's one of those diseases that is, we probably don't talk about it enough. After she mentioned that, I'm thinking that, we may not mention lupus enough, because if you catch it early, a lot of people are able to keep that under control. But the longer it goes on, especially if it's untreated, it really can cause a lot of damage. And so that kind of inspired me to say, hey, you know what? Look, I should probably do a show on lupus, kind of go over it and talk a little bit about what it is, how it's diagnosed and how it's treated, kind of, very high level, because lupus, there are actually people that actually focus on lupus. They're actually kidney doctors that focus on lupus inside the kidney because it's that specific. And some people that are hard to control, they use very specific medications in order to maintain the control of that lupus. So that's, yeah, like I said, that's kind of the background. I kind of wanted to frame it that way so you can kind of understand a little bit about it. And as always, I'm a doctor, not your doctor, so make sure you definitely get this one. Any specific questions about this one checked out, or if you feel like you got symptoms, make sure that you talk to your docs and say that if you think you got some symptoms of lupus because you've seen someone, or if you have family members that have had lupus, make sure you bring that up so that those symptoms can be worked up. And if you do have lupus, it can be treated in an early fashion. Okay. So let's get this started. So lupus is important to discuss because it can affect the whole body. I mean, quite literally the whole body. It can affect, the joints. It can affect the skin. It can affect blood, lungs, heart, brain. But like one of the things that we know is it can definitely affect the kidneys. It can be difficult to recognize, difficult to diagnose, and like I said, in some cases, very, very serious. But the good news is that there are treatments, there is hope, and early recognition can make a major difference. I mean, it really can make a major difference in the outcome of your lupus here. Okay, so we're gonna, kind of like we always do, break down lupus into some plain language, so you walk away from here like, I understand lupus a little bit better. Okay, I understand lupus nephritis a little bit better. So we're going to talk about a little bit about what it is, who's at risk, what symptoms to look for, how to test for it, treat it, and why kidney involvement has to be taken very serious. Okay, so let's start with kind of the basics. That's what we always do, right? We always start with the basics. So what is lupus? So lupus, so the name we typically give lupus is systemic lupus erythematosus, SLE, and it's an autoimmune disease, and it's a chronic autoimmune disease. And what autoimmune is we may have talked about this before. We're going to touch it again. Autoimmune means the immune system, and so the immune system is supposed to protect you from infections. For whatever reason, it starts attacking its own body. So the same, cell components that are there to fight off infections, fight off the flu, fight off, pneumonias. For whatever reason, they start attacking the body just out of the blue, right? And so, so instead of fighting the germs, it mistakes otherwise healthy tissue for an enemy and starts causing inflammation and fighting it. Okay, and this inflammation can show up in many different places. So one person may have joint pain and fatigue. Somebody else may have skin rash and hair loss. You can develop inflammation around the heart or the lungs, and of course, you can always affect the kidneys as well. Okay, so this is the reason why lupus can be so confusing and actually really hard to diagnose, because it's not going to look the same in everybody. So it's not, a heart attack for the most part looks fairly similar in most people, right? But the lupus, oh my God, it can present in so many different ways. Okay, and then there are other forms of lupus. There's lupus that affects the skin. There's a lupus that's from medication. So there's certain medications you can take that will mimic lupus. Okay, so so they're all different. There are a number of different types of lupus, but for the most part, like I said, when we talk about lupus, we're talking about the one where your body kind of fights itself, because even these other ones are kind of autoimmune as well. Okay, so So how common is it? So about 200,000 people are estimated to have lupus in the United States. It's much more common in women than it is in men. So it is extreme. I mean, when I say a lot, I mean, about 9 out of 10 women, people with lupus are women. Okay. Especially common during childbearing years, so roughly 15 to 44. It does not affect all communities equally. More common in Black, Hispanic, Asian, and American Indian populations than the white populations. Um, and Black women and American Indian women tend to have an especially higher risk. Also, Black patients with lupus tend to have more severe disease and worse outcomes. So for our audience, that really matters. So if you're a woman of color, and you're experiencing unexplained fatigue, joint pain, rash, swelling, and definitely kidney problems, lupus really needs to be on that list of possibilities. So if they're working something up, can't really find it, that is one of the things to look for, to make sure you don't have, lupus or an autoimmune disease in general. So that's one of the things to always keep an eye out. Okay. So Black women with lupus, 2 to 3 times higher risk of some of the negative outcomes there. Okay, so now the question, of course, is, why does this happen? What triggers the lupus? And honestly, no one knows the exact cause. Now, there does seem to be a genetic component. So there's a genetic component, seems to be a hormone component, and of course, immune system, because it's what's going on. And there may be some environmental triggers. So for people, some people may be born with a tendency that makes lupus more likely. Then the hormones may be, kind of triggering things. So some of these things, and I think we talked about this with the APOL1, sometimes things require what we call a second hit. So even if you have a set of genes that make a particular disease more likely, sometimes it's not just a gene. Sometimes you need something else, like an environmental, what we call trigger, or hormonal trigger, or something else that kind of triggers kind of what's in there. Okay. It's almost like watching cartoons or Marvel. There's the evil villain that's sitting there, and at some point in time something happens and they cause the evil villain to kind of activate. And so that's kind of what this second hit, or this trigger, is thought that these cells that are causing the problems are there. They have the genes, but until they get that second hit, they kind of lay there dormant, right? So some of the possible triggers are sunlight, viral infections, certain medications, family history also matters. But just because you have people in the family doesn't mean you're guaranteed to get it, but it does make it a little more likely. Okay. So just remember that lupus is not simple. It's usually not one thing. And it's usually a combination of risk factors that all come together. Okay. So now, what symptoms should you look for? Like, yet again, we just talked about this. There are all kind of symptoms out there. But there are certain symptoms that are a little bit more common, or a little bit more likely to kind of make a doctor or a clinician's brain think, maybe we should look for lupus, right? So common symptoms include fatigue, fevers. Like if you got fevers and you're not really sick otherwise, that can be a cause. That can be a symptom. Joint pain, joint swelling, rashes, sensitivity to sunlight, and there's something called a butterfly rash, which is kind of what we really think of as pathognomonic. So if we see somebody that goes out in the sunlight and they get this rash that looks kind of like a butterfly on the face, that is really something to be investigated. Some people get mouth sores, hair loss, unexplained hair loss. Some people get chest pain, shortness of breath, swelling in the legs, and going back to the kidney, sometimes you'll have foamy urine, which means that there's a little protein in there. So these are some of the common symptoms. So some people may have a few of those. People may have, like almost, most people are going to have like at least 1 or 2 of those. But, there are people that just get it on the skin and nothing else. So that's something to always consider. And so So some people, yeah, like I said, they just feel tired all the time and stuff of that nature. So that's it. So, and this is why lupus can be missed. Lupus can be easy, especially stuff like fatigue. It doesn't take much to feel fatigue. There's a lot of causes for fatigue. But when you have the fatigue and you have the other things, that's when people really need to start thinking about what else could be going on, especially if you don't have an exact answer. Okay? Also, like I said, this lupus can mimic other diseases. And then sometimes you just, like I said, you're just busy. You think you're stressed. You think you're overworked. Like I said, remember this is affecting women of childbearing age, and so you might have spouses. Might have a spouse, may have kids. You got the job, and so any of those things can make you think that make you ignore a lot of these signs and symptoms. Okay. So we talked about what lupus is, talked about why it's important, talked about some of the symptoms. So after that, so you go to your doc, right? So and you say, hey, look, I got these symptoms. I listen to Dr. Brown. Dr. Brown said I should think about lupus. So say to your doctor agrees. Okay, I agree with Dr. Brown. Like I said, I think we should screen for lupus. So then comes, well, okay, well, what kind of screening are we going to do? What kind of screening are you going to do, right? So just remember, there's no single test that by itself says yes or no for lupus. Okay, so no single test is usually a number of, it's kind of like putting a puzzle together. So you got to have, a lab test here. There might be another test, and it might be the symptoms, and you got to put all those things together before you come up with a diagnosis of lupus. Okay, so so the first thing is to be aware, to even think to put lupus on what we call our differential. That's the first thing. So that's where the screening starts, is to even think about it. So sometimes if you're having these things and somebody, your doc is, kind of saying, oh, thyroid, or like I said, maybe just tired, things of this nature, bring up the issue. Hey, could this be lupus? Because sometimes that's enough to kind of trigger something. And so once that's on the list and we're thinking, and the doc, nurse practitioner, PA is thinking about it, now you want to know, okay, well, what kind of test would you use to screen for? And one test that you may be familiar with or may have heard about is something called an ANA test. It's short for anti-nuclear antibody test, and it's a common screening test. And what we do with that is, you kind of order the test, you get it back, and if it's positive, now we're cooking. Now we got a clue, a real clue. So ANA is usually the first clue. So now, but the thing is this. So even though you have a positive ANA, it does not automatically mean you have lupus. So you can be otherwise healthy with a positive ANA. So, and then their ANA can be a marker for other autoimmune conditions. So this is just a first clue that something may be going on. But it is very useful, because it really does. ANA is positive. Oh, let's see what's going on here. Okay, so so that may be the first clue. All right, so then there's actually criteria that you have to use. There's actually extra testing. We won't go through all the testing because it's actually quite a bit that has to be done in order to kind of confirm this suspicion. Okay, so once this lupus is suspected, now we got to look at the whole picture. Yet again, the puzzle. We're trying to put this puzzle together to try to help make this diagnosis. So this is going to include medical history. It's going to include the physical exam. It's going to include blood work and urine tests. Sometimes it even includes a biopsy. Okay, so in addition to the ANA test, other blood tests that may be used is an anti-double-stranded DNA. They're anti-Smith antibodies, anti-phospholipid antibodies. So there's a whole slew of lab tests, and I'm not going to go into details on all those because it's just, this is just not the place for that, right? And then of course for for the kidney, we'll talk about kidneys because that's what we do. There's urine testing, so you might be looking for protein. The other thing that might be a clue is blood in the urine. because that can be a sign that that lupus is actually in the kidney acting up. Okay, so if you see protein, blood in the urine, you don't have a history of diabetes, no hypertension, and it's just kind of sitting there. One of the things that has to be on someone's mind is the possibility of lupus, especially if these other symptoms that we talked about are going on. Okay. All right, and then, like I said, there is a criteria, so we can kind of kind of pull up the book, see, all right, where's the lupus, and read up on the most recent classification theory. And yes, you will be looking things up because it's not it may not be that common. The other thing that people do, the docs do, is refer. So we talked about referrals before. So you can refer to a specialist. So the specialist that tends to that docs tend to refer to is something called a rheumatologist, because the rheumatologists kind of specialize in these autoimmune diseases, these arthritis symptoms. They kind of the masters over these sort of diseases. So one of the things that can happen, especially if you start getting the positive ANA and maybe the double-stranded DNA came back, the person's got some symptoms. Some primary docs may feel comfortable. They may start your treatment, but a number of them will probably refer you to a rheumatologist to kind of get a little bit more of a workup, a little bit more definition about what you have. Okay. So, all right. So we talked about what lupus is. We talked about why lupus is important. We talked about how we're going to screen for lupus, and why it's so difficult to figure out what's going on there. So we're doing all these things. All right. So now, of course, what we're going to talk about, lupus and the kidneys, because of course, not only is it just, what I do, but also because lupus and the kidneys is really serious. Okay. Because, it's really serious. We run a significant risk of losing that kidney with what we call lupus nephritis. So when lupus affects the kidneys, it is called lupus nephritis. And this is when that immune system is fighting the normal kidney tissue, causing inflammation, causing damage. And like I said, one of the tests that we look for is that urinalysis, and we can see protein in the urine, we can see blood in the urine, and that could be a sign of lupus nephritis. And that inflammation over time damages the filters inside the kidneys, and that's where the blood and the urine come from. And the thing is that as it attacks these filters, at some point in time, the kidney function is going to start declining, because remember, we only have so many of those filters there. So the early inflammation it may be early, and like I said, it's just causing inflammation, but over time it starts damaging. When those filters get damaged, like I said, at some point in time, you will lose kidney function, and you just slowly see that kidney function decline. And how do we monitor the kidney function? With eGFR, that kidney number. Okay. So, and sometimes you can have, lupus nephritis. That's kind of obvious. The thing is that, when you have these signs, these symptoms, like, you have swelling in the feet or around the eyes. I mean, you can just be really, really puffy, weight gain, and you can tell it's just all more, you're not really eating more. You might have foam in the urine, and we talked about that before. That's that protein. You might have blood pressure that you didn't have blood pressure before. All of a sudden, now you got blood pressure, high blood pressure, and this could be a sign of this lupus nephritis. Okay. And like I said, kidney disease, so it's silent. We talk about these silent diseases that are around here. So when that happens, like I said, we need to be aware of this. And people with lupus are really prone to this lupus nephritis. So you can have lupus nephritis where they don't really have a lot of other symptoms, or you can have these other symptoms and then all of a sudden develop the lupus nephritis when the lupus attacks the kidneys. Okay, so now since lupus nephritis can be severe, you want to catch it early. You want to catch your lupus nephritis early, because the earlier you catch the lupus, the earlier you treat the lupus, the less damage it can cause. So if you catch it late, it may have caused damage that you can't uh, damage the tissue, and you can't get that tissue back. But if you catch it early, you can put that medication on early and then take care of that kidney for a longer period of time. And honestly, this is for the rest of the body as well, because yes, I'm talking about the kidneys, but like I said, it can affect the heart, the brain, all this other stuff. So the earlier you get that diagnosis of lupus, then the earlier they can put you on treatment for the lupus, and they can monitor you closely. So now when you get these symptoms, like you're more tired than usual, you have a diagnosis of lupus. Make sure your lupus is not acting up. Okay. Okay. All right. So now we got that. We talked about lupus nephritis. Oh, how is lupus nephritis diagnosed? So typically, honestly, like a lot of other, like if it's diabetes or hypertension, we will do what we call a clinical diagnosis, where we don't actually do a test, but we just kind of put the puzzle together and say, you got diabetes for 10 years. It hasn't been controlled. You got protein in the urine. This is probably diabetic nephropathy, right? So with lupus, it's a little different, because the blood and the urine, and the blood and the protein in the urine is kind of suspicious. A lot of times these folks are younger, so you don't want to miss the possibility of lupus nephritis. So a lot of times, if lupus nephritis is suspected, then in addition to the urine test and blood test, which probably help come up with a diagnosis, you also wind up getting a kidney biopsy. Now, what's a kidney biopsy? So, of course, you've heard of biopsies of masses and things of this nature. So you can also biopsy the kidney. And when you biopsy the kidney, you take a microscopic look at that kidney. You can tell if there's inflammation. You can tell if there's scarring. You can tell if it's just normal. So all these things can be told inside of the kidney. And the changes that are there, sometimes you can see a pathologist can say, this looks like a lupus in the kidney. And they'll write that on there. And that actually may help make the diagnosis of lupus. And even when you get the lupus nephritis diagnosis, there are actually stages of that. So they can tell if it's just a mild case or if it's a very severe case. And that can affect how you're going to be treated. Okay, so now we talked about all that. How is lupus treated? So treatment depends upon how severe the disease is and which organs are involved. So there's medication called hydroxychloroquine. It's kind of the foundation medicine. So even if you got a mild case, a lot of times you're going to get on that medication. And it's just kind of the foundation. It really just foundation medication for treating lupus. Sometimes you get steroids. So that's to kind of calm down that inflammation. And remember, this is your body fighting your body fighting itself. So you can use these. They're really you're really suppressing the immune system when you're trying to fight lupus, because that's what it is. The immune system fighting itself. So you got to get it to calm down the immune system. Stop fighting me. And so that's what you're doing. So steroids are something you do, but you try to not keep people on steroids too long, because there's a lot of bad side effects that you can get from being on steroids. So then there's other medications. We won't even go through a lot of them, but they're designed to suppress the immune system and keep it under control so that it doesn't affect the body anymore. And then there are certain what we call biologic or targeted therapies that are newer, but seem to be better at controlling this disease. And this is especially for people that are having, where the disease is just kind of running rampant and just causing all sort of, for lack of a better word, chaos around the body. Sometimes you have to use more specific therapies. Okay. And so the overall goal is not just to make that person feel better. The overall goal really is to really protect organs, protect the body over time. So sometimes, if someone checks some labs, lupus person may not even feel bad, but they can tell in the labs that the lupus is becoming active. They might make adjustments to your medication to get that lupus to calm down before it even activates. Okay. So now, as we get ready to wrap this up, lifestyle still matters. Yes, lupus is an autoimmune disease, and most of the time will need some prescription treatment. Lifestyle still matters. So people with lupus still benefit. They benefit from not getting too much sun. They benefit from not smoking. They benefit from getting adequate sleep. They benefit from managing stress. And about the sleep and stress, remember, we don't know what triggers this. So you don't want to get you don't want to be stressed and have those bad stress hormones running around your body, and that possibly activates something. You want to keep that body under control, right? You want to continue to stay active, because the body at motion tends to stay in motion. It helps you, it's going to help you just kind of in general. You definitely keep the blood pressure under control, because that helps that's always going to help the kidney. It helps the heart as well. Keep your follow-up appointments. Please keep your follow-up appointments. I know it's going to be a lot of a lot of appointments, a lot of lab draws and stuff of that nature, but you want to keep this under control. You want to get this diagnosed, and once it's diagnosed, you want to keep this under control. If they treat you with medication, the symptoms get better, the labs get better, they can stretch out the appointments. But this is a disease you do not want to let just run rampant, because it can cause a lot of damage really fast. And like I said, your life could be on the line. Okay? Make sure you get your regular appointment. And the kidneys are involved. Blood pressures on it is really important there. And like I said, lifestyle does not replace medical care for lupus, but it really can support you overall. Okay, so now I think we've kind of covered most of our. I think we covered most of our stuff there, right? So we covered pretty much everything. Pretty much, we covered the introduction of lupus, and we kind of gave you a high level view of lupus nephritis. So the take-home points. Number one, if you have unexplained symptoms, they keep coming back, don't ignore them. Go to your primary care. Make sure they're being addressed. If you have fatigue, joint pain, all these symptoms, yet again, bring them up to your primary care. If they can't find a reason, and they just ask them, have they looked for lupus? So make sure you do that as well. Number three, don't self-diagnose lupus from social media alone. Lupus is real. Lupus is serious, and it's very complex. It requires proper medical evaluation. Even the docs will send it to the docs that focus on this disease, because it really is that complex. Okay. Now, if you do have lupus, make sure that someone is checking your kidney function, the urine and that EGFR. Make sure that that's being monitored, because kidney disease can sneak up kind of quietly and quickly. So make sure that's being screened. And also remember, early diagnosis matter. So the earlier you get diagnosed, the earlier you can protect your organs. Okay, so make sure you do that. All right, so as we close up, lupus is a chronic autoimmune disease that can affect almost any organ in the body. So it's more common in women, especially the childbearing years, and disproportionately affects communities of color. It has no single cause, no single diagnostic test. You really need docs to kind of help you put these puzzle pieces together to figure out whether or not you have that. It may require blood work, repeat blood work, urine testing, and sometimes even a biopsy to diagnose. So when lupus affects the kidneys, the stakes become higher. Lupus nephritis can lead to really serious kidney damage. So make sure that someone is monitoring your kidneys and treating them appropriately. Okay. So yet again, I just want to thank everybody for listening for listening to Health Facts, to tuning in for Health Facts. I'd like to thank the listeners on WVOE. I'd like to thank the listeners on Facebook and YouTube. Whether you're watching this live or you're watching the recording, we'll greatly appreciate this. So I'm Dr. Christopher Brown. Please share this episode with someone who may need it. And remember, paying attention to your body and getting evaluated early can protect your health for years to come. Thank you all very much, and we will see you again next week.
Thank you, Dr. Brown. God bless